All right, well, I'm delighted to now have the opportunity to welcome our next speaker. Karen Cook is a specialist advisor at Health Workforce Australia and has over 30 years of experience as a nurse in a variety of practice areas, not only in Australia but overseas. And she's worked for a number of years in nursing and midwifery regulation at both the state, national as well as international levels. Our aim of this conference is to showcase extraordinary achievement in your profession, and in addition to Karen's nursing qualifications, she has qualifications in health administration as well as business administration, and is also a graduate of the Australian Institute of Company Directors. She also volunteers as the Vice President of the Board of Carers Australia. So I'm delighted to say that this morning Karen will be sharing her insights on whether it's a boom, a bust, or a balanced health workforce in Australia. So let's put our hands together as we give an uplifting welcome to Karen Cook.
Thank you. Thank you. Thank you. I recently did a NIDA masterclass in public speaking, and they said, before you go up on the stage, do three things. Put your crown on your head. Put your cape on, and that cape goes for metres, and turn your headlight on. So that's my advice to all the people speaking here over the next 2 days. Crown, cape, headlight. You can do it. What I want to do today is tell you a story. On the 14th of February 1979, I started my nursing training here in Sydney at the Prince Henry Prince of Wales Hospital. It's 35 years ago, for those of you who are mathematically challenged. It was indeed well before many of you were born. Thank you for noticing that. When I finished my training 3 years later, I couldn't get a job immediately. We had too many graduates, and many of us had to wait some months before we could get a position. A couple of years later, after I'd been working at Prince Henry, I met the man of my dreams. My story is we got engaged 6 days after we met. No time to get to the Eiffel Tower or to Michael Hill. And I followed him to England to live. I got to England and there were nurses out of work, nurses unemployed. There were no jobs, except in aged care, because no one wanted to work in aged care. So I got a job in aged care. Not surprisingly, because no one wanted to work in aged care, I had a somewhat meteoric rise into management. And at the age of 24, after 2 years as a registered nurse, found myself in charge of a ward. I was the youngest person working on the ward. And I had no idea what I was doing. None whatsoever. Because my elevation into management wasn't necessarily based on my demonstrating any capacity in the management arena. I was just the only one willing to take it on. And so I reflect on that time and I think about some of the things I did and the terrible things that I said, and I think, oh my God, if only I had had some support and some leadership development to develop up the skills I needed in that role. I came back to Australia, and a couple of years later I was running a medical ward back at Prince Henry Hospital when the government accelerated the transfer of nursing education into the university sector, and overnight our staffing was decimated. We had no one. Our response was to start employing lots and lots of agency nurses. You don't have to be Argus the Boy Wonder to work out that they were employed at other hospitals but dropped their hours there so they could pick up a bit of extra money on the side as an agency nurse. And a completely indiscriminate approach to the immigration of nurses. So at one stage on my ward I had a nurse from Russia. He'd actually been a doctor in Russia, but we thought it was okay he could be a nurse here. I had a nurse from South America. I had a couple of nurses from New Zealand, and I had a couple of nurses from the Philippines. We didn't actually assess their skills, we just put them to work under a supervised practice model. And that was lovely. The nurse from the Philippines was beautiful until the day she got sent relieving on a surgical ward, and we realised that in the Philippines the doctors do the dressings, and she'd never done a dressing in her life. Now I'm telling you all of this not because I'm wanting to have some sort of self-indulgent trip down memory lane. I'm telling you this because that was 30 35, 25 years ago, and yet today the same problems exist. We currently have, according to reports recently in the media, not hundreds but thousands of newly graduated nurses unable to find jobs. Those nurses won't stay, they will go and find other jobs. And at the same time, our research has indicated this looming shortfall of nurses, which will be exacerbated because all of these beautiful, bright young things will have gone elsewhere. We have a completely indiscriminate approach to the immigration of nurses into this country. Now, don't get me wrong, I think in a multicultural society we must have a multicultural workforce. I think they enrich our workforce. But it does beg the question of why there's indiscriminate immigration of nurses into the country when we have got new grads who can't get jobs. And there's a patchy approach to the assessment of those internationally qualified nurses and midwives. Now, I know the NMBA is working on that, but at the moment we still haven't got a consistent approach to how we do that. We've got constant complaints about new graduates not being work ready. Is that true? Or is it that the workplace is not new graduate ready? And so those nurses are leaving the workforce in droves. And we're still putting people into those management positions with no necessary identification of leadership skills and certainly no support to develop those skills when they go into those jobs. And no wonder they fail. And no one still wants to work in aged care. Einstein said that insanity is doing the same thing over and over and over and expecting different results. My view is that we need to stop this boom and bust approach to nursing in this country. We need to get a balance. We actually do need to do things differently so that we get different results. And I think we can do that. I really do think that we can. There's a lot of work that we can do about management and leadership development. There's a lot of work we can do about preparation of graduates for the workplace and support for those graduates while they transition from a novice practitioner into a confident practitioner. There's an enormous amount that we could do to get people to understand that working in aged care is very exciting and it's a very rewarding career pathway. But all of the problems that we've got are continually exacerbated by a range of other things, an ageing population, which means we also have an ageing nursing workforce. We've got incredible fiscal restraint policies, which we're all experiencing on various levels at this point in time. And those things are driving changes in the way that we do our business. We've got less people actually entering the workforce. It's all very well for Health Workforce Australia to say we've got a huge shortage of nurses and we need more nurses. The reality is the pool of people entering the workforce is getting smaller and smaller. And so we're going to have to start to be terribly, terribly creative about the way that we use people. But I do think that we can do that. Because I think what we've got now is a really good evidence base for what the problems are, which then leads to some really good answers for what the solutions are. We've got fantastic relationships between the chief nurses, the council of deans, the professional bodies, the industrial bodies, the educators, and I think we can build on those existing relationships to get those people together to come up with some solutions, to develop the transition process, to develop the leadership process. And I think if we do that, if we all put our thinking caps on and we all get together and we all do our bit about this, we can achieve that. We can get the right number of nurses with the right skills, in the right place, at the right time, delivering the care that the Australian community needs. And you're all part of that. And I would welcome your input into that, and I would encourage you to be a part of that. So thank you very much for taking the time to hear my story, my trip down memory lane. And enjoy the conference. I think it's absolutely one of the most amazing conferences I go to, and I go to a lot, Kathy, we know that. This is one of the best. And so I think get out there and just have the time of your lives, ladies, because it's a fantastic time, and men as well. Thank you.